I'm going to present you a case report of the use of topical ozone therapy as an adjuvant in the treatment of complicated wounds, in the case of sunburn wound. It was called when the ozone layer fails to protect ozone oil sheet. Wounds in diabetes tend to heal slowly and are often associated with difficulty to treat infections that in most cases require surgical intervention. Inefficient protection and accidental injuries can cause ulcers that in more severe cases can lead to the amputation of the limb or part of the limb. Ozone is a gas that was initially discovered as an oxidant and disinfectant in 1834 and played an important role in the treatment of amputations in soldiers during the First World War. Since then, numerous studies have evaluated the effects of ozone in the treatment of skin wounds. Topical ozone therapy is an adjuvant in the treatment of chronic wounds and diabetes due to its antimicrobial and neoangiogenesis promoting effects, increasing local irrigation, accelerating the formation of granulation tissue, and reducing the healing time. Our case was a 85-year-old female patient. Diabetic and hypertensive that suffered a third-degree sunburn. This is an error, is a second-degree sunburn on her right eye during the sun exposure following a fall with loss of consciousness of approximately 4 to 5 hours in the agricultural field. The wound presented a recurrent infection, stagnation of the healing process, despite prolonged dressing with hydrocolloids and surgical debridement. 2 months after the injury, the wound was like this. 2.5 months after the injury. Then we start topical ozone therapy with ozonated sunflower oil as an adjuvant of conventional therapy. 2 weeks after the initiation of treatment with ozone oil, it was 3 weeks of treatment. As such, there was a significant increase in the healing process speed, reduction of purulent exudate, rapid formation of granulation tissue, repair of a large area of the wound, and a considerably pain relieved. 4 weeks of treatment. In the meanwhile, there was an episode of recurrent infections that was treated with treatment and antibiotic therapy with a good response. And then 5 weeks of treatment, 8 weeks, 9 weeks, 10 weeks, and there was a complete healing, approximately 90 days, so 11 weeks and a half, after the introduction of ozone therapy. This was the final result. So as a conclusion, numerous articles have suggested a relationship between diabetes mellitus and oxidative stress. Hyperglycemia leads to the generation of reactive oxygen specimens which can overcome the defense capacity of antioxidant enzymes. So these effects are associated with complications such as microvascular diseases in the retina, kidneys, and peripheral nerves. Furthermore, microvascular disease leads to difficulties in healing chronic wounds. Because these chronic wounds are a common and costly complication that can lead to limb amputation. Some authors, and Chini, investigated the effects of local ozone therapy in the treatment of diabetic foot ulcers and concluded that ozone therapy appears to accelerate ulcer healing and reduce the need for amputation. And other authors reported also the importance of ozone therapy in the treatment of chronic ulcers. Because of the antiseptic properties, induced the formation of granulation tissue and neoangiogenesis. And in this case, the topical ozone therapy may have acted by induced neoangiogenesis, preventing the proliferation of microorganisms and promoting tissue adaptation to oxidative stress. All these factors lead to complete healing, since without infection and with sufficient irrigation, the healing process was favored. Obrigado por vossa atenção.